Hey everybody, Dr. Monica here, just going through some scans for one of our headache protocol people. So this girl started care back in August. So just towards the end of August, started care. Was initially coming in having headaches all of the time, most of which were migraines. She was having so many headaches and had so many over such a short span of time that she claimed were some of the worst that she had ever had. Just before she started care with us, she had actually been in urgent care because her normal emergency meds were not working properly. Let's go through her first scans when she first started. This thermal scan up here is where we see how well the nerves are talking to each other. So you can see that she has this really, really big shift in the right side of her neck. She also had mentioned some lower back discomfort. She does some outside work, partially inside, partially outside. So she had noticed a low back injury that kind of flared up over the summer and had gotten worse. So overall, we see that this left side of her low back is working really, really hard compared to this right side, and the right side of her neck is working really, really hard compared to that left side. So when we look at this next scan, this one tells us how well her nerves are working top to bottom. So ideally, these scans come up and look like this. So you can see that this big shift on the right side is causing her left side to actually enter a shutdown. In the top part of our neck, or in that upper cervical region, we have a lot of neurology that controls our rest, digest, and restore. So in a lot of our headache, and especially migraine patients, we see that they have a lot going on in this neck region. What we also see is that over on her EMG, she's got just a touch of upper neck tension. This can be very variable in between patients. Sometimes people have a lot of tension, and that can contribute to things like tension headaches. In other people, that's not necessarily the case. When we move on and look in her heart rate variability, this side of the graph is that fight or flight response. This parasympathetic side is rest, digest, and restore. So in an ideal world, people are on the midline because we know that we need to be able to access both that fight or flight and that rest and digest. We just don't want to be primarily sitting in one or the other. So for her body was doing a decent job of still being able to maintain both that fight or flight response and that rest and digest. But because of all of this other neurologic deficit that we saw over here, that neurological overwork, her body was really, really tired. So this little white dot is her. Ideally, we see people up further in that green energy bubble. So you can tell that both her symptoms and her neurology were telling the story of she's chronically stressed, she's chronically tired. So when we did a re-exam on her, we did that right at the beginning of November. So the protocol for her looked like a month of coming in 3 times a week. That's a lot of dedication. That's a lot of visits. We rescanned her there and at that point had gone down in severity. So anybody on our headache protocol comes in and completes a headache questionnaire. And it talks about the impact that their headaches are having on their life. When she first started coming in, she sat at a 61 or a severe impact category. By week 4, she was already down to 54 points, which was some impact on her life. Still, her headaches and migraines were having some impact on her life, but nowhere near where they were before. At that 4-week point, she was saying that she was feeling a lot better and overall having fewer headache and migraine days. Not that she had 0, but she was just having fewer. So then when we look at this re-exam in November, we see that her nerves have really cooled down. We still have a couple minor spots, but overall her nerves are doing a lot better job of communicating right and left side. When we look over here, we see that this temperature control between the top and bottom of her spine is still somewhat chaotic. In this transitional phase, it's common for people, their DTG or that top to bottom control to get a little bit worse. We'll come back to this scan, but overall, remember that her nerves are doing a lot better job of talking to each other. When we look at her EMG, this is about the same. Again, a little flare up in her low back. The EMG is probably the most day-to-day dependent one. If you slept funky the night before, that can sometimes give us a bad reading. But overall, this one looks pretty balanced, pretty low on muscle tension. When we look at her heart rate variability, this is actually the scan that improved the most. You can see that she was really, really low on energy before, and now not only is she further up the graph, but she's within that normal limit. So anything within this box is considered within the normal limit. When we asked her how things had impacted her life, she said that she hadn't had any migraine symptoms in several weeks. Her number of headaches were down drastically, and she basically had her life back. Before starting care, she didn't realize how much her headaches had overtaken her day-to-day life. When we asked her what her expectations were for care, she essentially wanted to have maybe a better day or two, and now she's experiencing most of her days without a headache or migraine. When we asked her why she continues care, she notices that she didn't get here overnight. That first phase of care, she was in here 3 times a week. She was doing a lot of modalities. She was spending a lot of time here. That second phase of care, the second 4 weeks, she cut down a little bit in frequency, but it was still a dedication to show up and go through the protocol like we had prescribed her. So when we asked her again, why do you continue to undergo chiropractic care? She notices that she wants to maintain the improvements and she doesn't want to backslide into the headaches over time. She's acknowledging that she came from a bad place neurologically and now she's done all this hard work and wants to stay where she has been. So that brings me to this graph again. Like I said, these graphs should look very, very smooth and symmetrical. This is a good reason for her to continue to pursue wellness chiropractic care. This isn't great. We see that she's got bilateral shutdown, but overall her body is going through what we consider a neurologic cleansing process. So it's like cleaning out the junk drawer in your house. Sometimes when we start to clean things out and make the drawer look really, really good, we notice that we make a bigger mess on our counter. Her body is so much more energy efficient now, and she's spending a lot of her days without headaches. If we just stopped here, we know that she may or may not revert to having old headaches, but we know that without chiropractic care, she was having those headaches all the time. We're super proud of her and all of the work that she did in this protocol and just wanted to share her success story.